The brain is the site of one of the most common major illnesses of the elderly, Alzheimer's disease. Alzheimer's disease, either alone or in combination with other illnesses, accounts for the majority of cases of dementia among the elderly. The primary care physician is ideally suited to diagnose and initiate early treatment and assess cognitive and functional changes over time. Early diagnosis of a progressive dementing illness is essential in order to ensure patient safety, to plan for the future, to provide education and support, and to initiate treatment, such as therapy with a cholinesterase inhibitor. In addition, early diagnosis is critical because there are also many reversible causes of dementia. Assessment of mental status with a clinically valid tool, such as a mini-mental state examination, is a vital component in the diagnosis and monitoring of all patients with dementing illnesses, including Alzheimer's disease. This examination is simple to administer, reliable, and has been extensively validated in clinical studies. Well, John, I haven't seen you for a while. How have you been?
Well, no complaints, Doc. Everything's fine.
You still running the business?
As a matter of fact, I've turned over a lot of my business to my son, not because I'm going to retire or anything, but it's just at this age I thought I needed a rest, deserved a rest. I'm not going to push so much anymore.
Oh, I understand. How's the family?
Let's see, we visited my daughter Nancy in California last year.
Oh, but John, it was April. Remember we had a 2-week vacation around Easter time? Oh, it was wonderful being with them and the children.
How lovely. How many grandchildren is it now, John?
2 daughters, Jennifer and Kate.
Great. Tell me, John, is there anything troubling you, anything that's preventing you from doing what you'd want to be doing?
Well, every once in a while I can't find things or I forget things sometimes, but no, there's nothing, I can't say there's nothing that keeps me from enjoying things, no.
Well, that's good, that's good. Well, we're going to have to get some blood tests, so we'll move you into the next room to have them drawn. By the way, have you had breakfast this morning? That'll matter for the tests.
Yeah, the usual, sunny side and toast.
Okay. You look worried, Carol. John doesn't seem himself. Have you noticed any changes in him?
Doctor, I'm not really sure. For one thing, he left in such a hurry this morning. He says he had breakfast. He didn't have any breakfast. Also, not long ago, he told me that some of his clients were complaining about the mistakes that he'd made in their taxes. So he's let our son take over most of the business responsibilities. I think he's just feeling a bit less involved. Maybe he feels, less useful now that he's at home more. He seems less interested in things. It's happened very gradually, but he's certainly not his old self.
How long do you think it is, looking back, since you first noticed any changes in him?
Oh, I remember about 2 years ago, John got so upset at the bank for making errors in his checking account. It turned out it was his oversight. Since then, I've been handling the bills.
Although at first glance John appears cognitively normal and socially appropriate, complaining only of minor bouts of forgetfulness, more focused questions reveal cognitive deficits. His wife confirms such concerns and gives further examples when interviewed later. She's obviously very concerned about changes from John's previous level of cognitive and behavioral functioning. In this case, the patient and his wife provide evidence indicative of his possible dementia. Because preserved social functioning may be misleading during the interview with the patient, a brief, validated mental status examination should be used in the primary care physician's office, even if only the family or caregiver provides information which suggests dementia. All of us may feel uncomfortable at first with such formal questions. However, this kind of test provides objective, quantifiable information, which is crucial to both the diagnosis and the assessment of change over time. One of the most widely used screening tests for dementia is the Mini-Mental State Examination, the MMSE. It consists of questions evaluating orientation, memory, attention, the ability to name objects, follow verbal and written commands, write a sentence spontaneously, and copy a polygon figure. It can take as little as 5 to 10 minutes to complete. The maximum total score is 30. It's easy to administer and may be performed by either the clinician or a staff member. Assessment of a patient with a potential dementing illness is incomplete without administration of a cognitive screening instrument such as the MMSE. The MMSE is best performed separate from the initial interview. Instructions should be given to the patient clearly, and the patient's educational level, as well as visual or physical impairments, should be taken into account when performing the MMSE. When conducting the examination, sit facing the patient, ensuring eye contact, adequate communication, and minimal distractions. Make the patient comfortable and establish rapport. Inform the patient that you're going to ask a standardized set of questions to assess memory. Questions should be asked in the order they are listed and scored immediately. Write down the responses verbatim, praise success, and avoid pressing on items the patient finds difficult. When more than one answer is given, the patient should be encouraged to choose one and encouraged to give an answer even if unsure. Partial credit is not given. Now we'll proceed to the actual administration of the MMSE. Today's date is Thursday, July 31st, 1997, and we're on the second floor of University Healthcare in Manlius, County of Onondaga in New York State. John, I want to ask you a few questions now to check out your memory. Okay?
Certainly, Doc.
Okay. Now, first tell me what date it is today.
Today's date is July 19th or 20th. I didn't see the paper today, so when you're semi-retired, dates don't mean anything anymore, you know.
Sure. What year is it now?
Oh, it's 1996.
Okay. And what day of the week is it today?
Thursday.
Thursday it is.
Yeah.
And what season are we in?
Well, that's hard to say. It's cool outside. Is it spring? Spring?
Could be. Okay. Now tell me the name of this building.
Syracuse Center.
Okay. And what floor are we on?
Well, Carol pushed a button on the elevator. I don't remember what.
Well, give me your best guess. You were here before.
I would say it's the third floor. I think that's what she said. Third.
Okay. Tell me what town we're in now.
Manlius.
Right, right. And what county would that be?
Onondaga.
And what state?
New York.
Right, right. Orientation. 1 point for each part correct. Maximum score is 10. John's score is 5. Now, I'm going to give you the names of 3 objects, and I want you to remember them. So I want you to say them after I've said them. Apple, table, and penny. You say them.
Apple, table, penny.
Very good. Registration. 1 point for each correct. Maximum score is 3. John's score is 3. Now I want you to spell the word world backwards.
D, L, R, and D.
Okay. Attention and calculation. Score 1 point for each correctly placed letter. Maximum score is 5. John's score is 3. The original version of the MMSE used serial 7s, which is subtracting 7 progressively from 100. If the patient was unable or unwilling, only then was world used. Now I want you to remember the names of those 3 objects. Do you recall them?
Oh boy, you got me here. I don't remember any of them. World? I can't remember.
No. Well, we knew that we had a problem with that. Recall. Maximum score is 3. John's score is 0. Tell me what this is.
Pencil.
And tell me what this is.
The watch, wristwatch.
Right. Very good. Naming. Maximum score is 2. John's score is 2. Now I want you to repeat after me. No ifs, ands, or buts.
No ifs, ands, or buts.
Very good. Repetition. Maximum score is 1. John's score is 1. Now I'd like you to take this piece of paper in your right hand, fold it in half and put it on the floor. Very good. Three-stage command. Maximum score is 3. John's score is 3. I want you to take this card and read from it and do what it says. Okay. Reading, maximum score is 1. John's score is 1. Score 1 point only if patient actually closes his eyes. And next, I want you to write me a sentence on this paper, any sentence. Very good, it is. Writing, maximum score is 1, John's score is 1. The sentence must contain a subject and verb and must make sense. Correct grammar and punctuation are not necessary. And last, I want you to make a copy of this. Maximum score is 1 point. John's score is 0. Well, John, that's very helpful. We've done a lot of things today, and we've got to meet up again and talk about the results of those blood tests. So what we'll do is we'll fix a follow-up appointment, and I'll go over everything then. Okay? What does the MMSE tell us? A score of 26 or better is consistent with normal cognitive function. A score of 21 to 26 is consistent with mild dementia, from 10 to 20 suggests moderate dementia, and less than 10 is consistent with severe dementia. However, you must allow for patients with physical or educational limitations, and also for those of high intellect who may do well on the test, yet whose history contains symptoms of dementia. John had some difficulty with orientation, scoring only 5 out of a possible 10 points, could spell only 3 letters of world backwards correctly, scoring 3 out of 5 points, and he could not recall any of the 3 words repeated earlier, receiving no points for that section. His naming of objects, repeating of a phrase, obeying a sequence of verbal commands, and obeying a written instruction were all fine, as was his writing of a sentence. He could not correctly draw the pentagons, no points out of a possible 1 point. His final MMSE score was 19, which confirms my impression that there is mild to moderate cognitive impairment. Although this helps to identify and quantify dementia if present, alone it is not diagnostic. A characteristic history, a focused search for characteristic symptoms, and for the various contributory or potentially causative factors by means of a full physical, including neurological exam, appropriate laboratories, and generally a brain image, CT scan or MRI, are needed for full diagnosis. But the MMSE, as an objective, reproducible test for cognitive impairment, is a vital component of the workup, which is not complete without it. The MMSE may also be used to track cognitive changes in the patient over time, and to evaluate the patient's response to therapy, such as a cholinesterase inhibitor. Responses may include symptomatic improvement or a lack of expected decline. The expected decline on the MMSE is 2 to 4 points per year in untreated patients with mild to moderate Alzheimer's disease. In summary, the MMSE is a brief mental status instrument that is a vital part of the assessment of patients with suspected dementia. If used properly, the MMSE can help confirm the diagnosis, assess stability or symptomatic improvement, and track patients' response to therapy. It greatly facilitates communication between providers and clinical sites about a patient's current status. In practice, it is best to administer and record the MMSE as part of the physical examination, rather than in the context of obtaining the medical history. The primary care office is optimal for observation of the patient over time and to perform follow-up evaluations. By providing reliable clinical information about a patient's mental status, the MMSE serves as a vital tool in the diagnosis, management and monitoring of patients with dementia throughout the long course of this illness. And the MMSE can be easily administered in the office, clinic, hospital and nursing home.